In this section, we're going to discuss the testing procedure, what happens if they refuse to take a test, or what happens if they fail a test. Remember, you're not asked to diagnose someone's condition. It is only your duty to determine if they appear to be under the influence and prevent them from performing safety-sensitive functions until you can be sure. This means having the person evaluated through reasonable suspicion testing for both alcohol and controlled substances. An employee might just be off today, just not themselves. So we don't want to diagnose them causing blame, saying because you're doing this and this, you must be or you are on drugs or under the influence of alcohol. That might not be true. Explain to them that these documented observations correlate with the conditions, the signs, and the symptoms of use. That's why we do the test. Once the employee has been asked to submit to the alcohol or drug screening, they have to submit. A refusal to test is treated the same as a failure or as a positive test result. If they refuse to get tested, they cannot perform safety-sensitive functions, and depending on your company policy, they may have other disciplinary action assigned as well. The employee can get a refusal to test as the result if they fail to provide enough urine for the drug test or an adequate amount of saliva or breath for the alcohol test, and there's no medical explanation for the inability to provide enough sample. They can also get a refusal to test if, in the case they're required to be directly observed or monitored for the collection, and they don't allow the doctor or the collector to observe or monitor them when they provide the specimen. They can also receive this result if they fail or refuse to take a second drug test or alcohol test if they're directed by the employer or the drug testing client, the company. This would happen if there was some kind of error or mistake, or maybe there was something confusing or fishy about the results. They would want to retest just to clarify and make sure that the results match and the diagnosis is clear. A refusal can also occur if the employee fails to undergo a medical examination or other evaluation as part of the verification process in the test. They can also receive a refusal if they have a shy bladder and they refuse to cooperate and come back, or drink water then come back, or if they have an insufficient saliva or breath for the alcohol test and they refuse to provide more. In short, a refusal occurs when the employee fails to cooperate with any part of the testing procedure. This also includes if they become belligerent or angry or aggressive towards the tester can automatically cancel that test, and the result would end up as a failure by refusal to test. Finally, and I guess the most obvious, is they'll get a failure on their test if either they actually have the blood alcohol concentration is too high, or they have a substance in their urine, or if the medical examiner can verify an adulterated or substituted specimen. So if they provided urine that was watered down, or there was some chemical components added to it. So if they find something that's been changed or altered, that can also result in a failure. If an employee fails an alcohol or drug test, they must be removed from all safety-sensitive functions until they've completed the requirements or the disciplinary actions, corrective actions training as outlined in your company policy. If they are a DOT-regulated commercial vehicle operator, several criteria must also be met before they can return to safety-sensitive functions. In other words, before they can even get behind the wheel again. The driver must be evaluated by a substance abuse professional, or otherwise an SAP. The driver must comply with the treatment prescribed by the SAP, and they must pass a return to duty test. DOT regulations require that employers advise their drivers of the resources available for appropriate treatment for alcohol and drug use. However, the regulations do not require an employer to pay for the rehabilitation or to even hold their job open while the treatment is being sought. How these issues are handled depends on your company's individual alcohol and drug policy. After a driver returns to their safety-sensitive functions, he or she will be subject to 6 follow-up tests in the first 12 months after returning to duty, and may be subject to any number of follow-up testing for up to 5 years. In addition to the reasonable suspicion testing policies and procedures, you should become familiar with the rest of your company's alcohol and drug policy. Follow the established procedures specific to your company for other types of testing, corrective actions, preventative education, record keeping, and more.